And now for something completely different.
Hi, my name is Annie Grossman, and I'm a dog trainer. This podcast is brought to you by School for the Dogs, a Manhattan-based facility I own and operate along with some of the city's finest dog trainers. During this podcast, we'll be answering your questions, geeking out on animal behavior, discussing pet trends, and interviewing industry experts. Welcome to School for the Dogs podcast. Hey, I am here with Dr. Lisa Lippman.
Hi.
And the boyfriend.
Richie Redding.
Redding, okay.
Yeah.
I wasn't sure of your last name. Dr. Lisa and Richie have their own podcast, which is wonderful. It's called Pets and Punchlines.
Yeah.
While Richie is a great lover of animals.
I thought you were just going to cut it short.
Too.
He's a great lover. And Lisa's a veterinarian.
Dr. Lisa is a veterinarian, and she's a visiting veterinarian, which means she goes into people's homes, which I think is super cool for many reasons, but a big reason is, did you ever read those books when you were kids about the visiting vet?
No, actually.
That series of novels about...
No, I don't know how I missed that. Nobody loved me, I guess.
Me either.
Shoot, All God's Creatures, I think they were called.
Yeah, okay. I mean, I know of them, but I actually never read them.
I never read
Somehow
them either,
it.
but I know about them. But
And
this
I
is
wanted to
clearly
be
a gap in both of our educations about pets.
Yeah, and did you loved
What
animals?
were our parents doing that they didn't make us read those books?
You loved animals from the get-go, right?
Yeah,
so, me too.
Of course. But what I think is cool about a visiting vet as a dog trainer is that a lot of dogs have too much stress to go to a vet.
Yep.
And a vet who understands how to enter someone's home is invaluable.
Thank you.
I think it's a need that really needs to be filled in and out of New York City.
Yeah, we appreciate that so much. And we do what we do too because, we work with you and your partner Kate a lot. I mean, I've brought Kate on house calls. So when
really?
I have animals, I brought Annie's partner Kate on house calls with me. So when I've had animals that are really fearful or what's like the PC way to say, like, difficult to handle?
Well, frankly, I don't know if this happens very much, but if someone had a puppy and wanted to do puppy visits in their home,
let's do it.
Vet, I think it's a great idea.
Oh my God.
Because you can, in a home, like, set up a situation that's kind of like going to the vet, but you're in the comfort of their home rather than stressing them out in a new place. But even more than that, I'm just thinking off the top of my head.
I love
here.
this.
But even more than that, I think that a lot of dogs get sick at the vet. That's my theory.
That's one of the things, and I think that's really interesting and something else we have to talk about that I've talked with other trainers about is, we tell you, don't bring your, be so careful with your dog's vaccination status. Don't bring them outside. But what are you doing when they're not vaccinated at all? Bringing them to the vet, which is like the most...
And the waiting room. I mean, I know at School for the Dogs, when we have playtimes, we do clean very carefully for puppies, and we don't have people put their puppy down generally until they're in the like disinfected area. And I know vet offices clean, but I don't imagine that they're cleaning every hour between patients.
The stress is just so crazy
plus,
too.
Plus the stress.
I participated in one blood draw. That we
At
did
a house call?
Yeah, we did a podcast.
We did a podcast / house call.
Yeah, my friend Rosebud, she had a dog that needed some blood drawn, and and also the point of the podcast was like, we have this aggressive pit. And so Richie got nominated to put the dog in a headlock during this thing. I almost passed out from the stress. By the way, by headlock, he means like literally just holding off the back leg vein for me. He was not putting the dog in a headlock, but he was literally just holding off the vein. No, I've rewritten the story, and it was gnashing, gnarling teeth.
Here's another reason for home visits: the owners can drink.
Right? Oh no, seriously, I've had people in like pajamas. I've gotten into people's beds. Like I mean, there's no place I won't go. Yeah. Oh yeah.
And I also think
we might want to talk about this. Whose bed did you get in?
Actually, usually for like euthanasia.
Oh, okay. It was super sad.
Yeah, it was sad. Yeah.
Happier topics. Let's move on from there.
I just thought somebody talked her into bed on.
But I was going somewhere before, which was that talking about puppy vaccination status and training, right? So this is something that I'm super passionate about, which is like, their critical socialization period being, and you correct me if I'm wrong, I always tell people I'm not a trainer. I will literally derail all of your training. I will let your puppy jump up on me and lick my face.
Well, I
please call Annie and Kate.
Yeah, but I wouldn't say that's derailing training. I mean, my philosophy is that training's happening all the time.
Right, with anyone.
Any interaction you're having with dog, you are training that dog.
Right.
And you know what? If you're training a puppy to interact with the vet in a way where they feel comfortable,
right.
like the fact that they're jumping up, like to me, I don't.
They're confident and happy.
I mean, if you weigh 80 pounds and the dog's a Great Dane, like
right.
we need to talk about it maybe, but like,
right.
know,
yeah. No, I hear you. But the fact that
that they're having a good experience with you in their home.
Yeah. And that the old school way of being used to be like, keep your dog in a bubble until they have all of their vaccinations is really no longer like the cool thing to do.
Right.
It's really, they need to be socialized before they are finished with their vaccines.
Right, but in doable doses, of course. And I think that's where something like the visiting vet, like plenty of dogs, of course, puppies can go to the vet and be just like goofy and happy and whatever. But I know I've seen puppies, and I'm sure you've seen puppies who are just like, what the fuck?
Yeah.
like just like totally freaked out by any novel thing. Yeah. I just had one yesterday. We had this little dog, Rico, from Puerto Rico, and just like every little thing.
Wait, Rico, I sent you Rico. Rico is mine.
Oh, really?
I sent him to you.
Oh my god! Well, you know what I'm talking about. Then. How adorable is he?
He's the cutest. I did all his vaccines.
Was he one of the?
He's an Animal Lighthouse Rescue. We got that litter like of 43 at once. It was like an insane.
Oh, it was that real big one.
Yeah, we got them all off the plane, like 43 of them at once. And so for me, it was kind of assembly line.
Right.
But
you remember Rico.
Puppies. Well, Rico. Oh, so he was nervous? Tell me, but let's work together on Rico.
My feeling about puppies as socialization goes is it's all about the associations they're creating. And I think when people think about like training a puppy, they think, we need the puppy to do X and we need the puppy to do Y, and it's important that the puppy not do these things. And I feel more like, you know what, during that socialization window, your job as a person with a dog is to just make the dog feel good about the world they're going to need to live in. And, and if that means like having, if that means a dog jumps up on you sometimes, like, okay like we have plenty of time to like deal with those issues.
So but what's like the big mistake that people make then?
Well, you know what? I think bringing her back to the vet stuff with a puppy, I think a lot of it is setting criteria too soon. For instance, someone comes into a classroom, and then I'll bring this back to like if they're going to the vet, right? But someone comes into the classroom to a puppy kindergarten class, and it's a puppy's very first time there, and right away they're, like, bingo, I want you to sit, bingo, sit, right? Like having this perfect idea, this like Norman Rockwell idea of like what it should look like when you're at a dog training class and my dog is sitting next to me, and I'll be just like, you know what, just feed him treats. Just like sit there and feed him treats. I don't really care what he's doing. And what I always say it's like when you send your kid to kindergarten on the first day and they do a crayon drawing, they're going to come back and show you the crayon drawing. You could look at it with your eyes closed and be like, that's great, nice job. And I don't think it's about spoiling the kid or spoiling the puppy, but just I just want the dog to feel good about being at school, comfortable there, especially a dog like Rico. Otherwise, if you're barking, you're telling the dog, I want you to do XYZ all the time. When you have a dog who's scared like Rico, tail tucked, close to the ground.
Yeah.
He got more and more comfortable, but he got more and more comfortable and was learning lots by the end of the time. But the most important thing for him to learn was just like, this is how I can exist. Exist here. You know? And I think a similar thing can happen at the vets. Yeah. Right? Where you have a dog on the table and you have, the owner has this idea of like, the dog should be sitting right now so the doctor can get the shot. And really the dog is just, really nervous about being there often, especially when like they're on the metal. Yeah, right, which is the total difference between doing it at home, right? Because we don't do that. But But I love this. I think we've created something new here because puppy appointments are some of my longest appointments, and half of those questions are really training behavior. Yeah,
it is weird that like the steel metal table hasn't been replaced in most vet clinics. That like it seems like they could make that a lot more dog friendly. In the fear-free
courses, I think. I mean, they talk about using like non-slip mats and stuff like that.
I was just thinking we have branded yoga mats that we use at our studio all the time. We should just give those to vets to use.
For real. The problem is they're harder to clean, and so if you're worried about like an infectious patient or something like that, but yes, we could make it a lot more pleasant for a lot more patients in a hospital setting.
But I don't think making dogs feel good about being there has ever really been the goal of a vet's
That's right.
office.
You're right.
Which has also usually not been the goal of a training facility, right?
Got it.
You don't. I mean, I think,
Yeah.
right? You don't, stereotypically, you think about bringing your dog to a dog trainer. You don't think about a place where your dog is going to be like
Right.
psyched to be. And as a vet, like, right? Like you want a dog who's psyched to see you.
Oh, yeah, for sure. That makes me so happy. And I love to use all the treats and try my hardest to make a positive experience. But
Yes.
and this is why I started house calls, because I want to be able to focus more on the intimate setting with my patients and my clients. But unfortunately, the reality is in a lot of clinic settings, the veterinarians just don't have time to.
course.
So,
But even here, though, with Chloe, like, there's one drawer that if she goes into that Chloe knows that's where she keeps stuff. Like
my medicine.
Yeah, especially like the vag and ear stuff. Like if you go for if she
She
goes
has a
for that,
recessed vulva.
Chloe bolts for me and tries to hide behind me, and her body temperature goes up like 10 degrees.
Yeah, she knows when
Oh.
I hit that drawer.
Well,
I
you could
can't
do
help
some
it.
counter conditioning there.
Yeah, I could.
So,
I could.
you know, or move it to another drawer, perhaps. But
Oh.
isn't it interesting how they learn to make those associations?
She just knows. Oh my God. Yeah. She's so smart. Even though she's never like stepped foot in a vet clinic. Actually, she's happy to.
Right,
When I
right.
bring her, when I used to bring her to when I bring her with me anywhere, she is happy to go into the clinic because she doesn't have a clue. But yeah,
Right, because all of her procedures have been at home.
Yeah, right.
You see, I guess that's an interesting like turn. That's like
Yeah.
a problem that could occur is then your dog is afraid to be at home. So
1,000%.
yeah, but with a puppy, so much of it should be pleasant. And I agree.
Yeah.
I mean, I don't agree.
Pleasant.
I can imagine that you say you go to these visits and then a lot of it is talking about how to care for the puppy, and you're like, you should call it
Yeah.
trainer. Because I have one of my best friend's mothers is like a pediatrician to the stars in New York City, and
Okay.
she spends something like 90 minutes for a first visit with the parents, like I think even without the kid there, sort of a like get to know what it's like to have a child
Interesting.
session
Yeah.
with every client, which was not my experience of having a pediatrician when I was a kid.
Right.
It was like where I went when I was sick.
Yeah.
But I appreciate that she does it. I'm sure her clients appreciate it.
Yeah, I just
right?
had some
Yeah.
guy that didn't speak English jam needles into me. That's the whole thing.
So when you decided to be a
House call.
house call vet,
Mm-hmm.
I was calling a visiting vet. Is that okay?
Yeah. You can call me whatever you
I
want.
actually have
Visiting
been
vet. Yeah,
sitting
that's
here every time you said it. I'm like, how did that not come up when we were kicking around names for the
Visiting
company?
vet.
Visiting vet. It's-
Yeah.
Visiting
great.
vet?
Yeah, it's
Yeah.
great. I'm just not mobile. The distinction is like that would imply that I worked out of a mobile unit.
A lot of
okay.
people
But visiting
picture
sounds
that
great.
she
House
has like a
calls
Ghostbuster mobile.
Do you have like a briefcase
Well, I
or
might.
where do you keep your supplies?
A book bag.
Okay.
Actually, and like 90% of what I need is just in my book bag.
You need
Yeah.
a bike with like. Did you ever see the show Call the Midwife?
No.
It's about London. These nurses in London in the 1950s and 60s, and you have to look at it now because
Yeah,
that's
I
how
will.
I'm picturing your getup. So as far as being I'm gonna just keep calling it visiting
Yeah,
vet because I
that's
like the
great.
alliteration.
Yeah.
A very visiting
Lisa
vet.
Lippman, the visiting vet.
Of vets in the city
When you have the alliteration of Lisa Lippman.
Right.
There, so we
and
got
Richie
that.
Redding.
Richie Redding. I didn't even think of the
Yeah.
double. Oh my God, visiting vet. Come on. I think you need to reconsider. Anyway, as a visiting vet, I'm interested in how you made that transition. Were you at a facility before that? Mm-hmm. And
Well, I trained at Blue Pearl, so
Oh,
I was
okay.
working like 100-hour work weeks, did
Yeah.
a lot of emergency
did you have
there.
a specialty?
No specialty. I mean, where you either focus when you don't have a specialty, you can either focus on emergency or general practice, as opposed to going into like cardiology or oncology. Those are like 3-year specialized training. But so I did exclusively emergency for a little while, and then I did exclusively general practice for a little while. And basically, I loved the idea of being house call, having the time with my patients and my clients, being in an intimate setting, seeing what their environment is like, having it be less stress for everybody involved. And I had a friend who started a house call practice. And so basically I said to him, I love this. Please let me join you. And then he decided he actually didn't want to do it anymore. So I created my own. And that's kind of where I'm at right now. So yeah, I just love the idea. And I found...
And I love the idea of you doing it on your own too.
Well, and you seem
Not
to
really
me
like setting out on your own and doing it. It's like it's such a different thing when it's your business.
and you seem to me like you approach it like an entrepreneur, not just like something that you're You know?
Oh, she's a hustler.
I mean, I have a just like you and Kate. I mean, I have a partner because I asked her. So I've grown the house call practice with my own clients from when I was working for my friend Alex. But then I like the idea of having a partner. I love collaborating. And so my friend, Dr. Lauren Benson, she's a brilliant veterinarian. She's super personable and fun and smart. And
she doesn't have an alliterative name.
No,
though.
she doesn't. Lauren Benson. No, how can we fix that?
She's getting married.
Yeah,
Can her name now
Should
be
we pick
Benny?
up an L?
no.
Betty Benson?
Yes, we call her Benny. So yeah, Benny Benson. That's perfect. Basically, I was just like, look, I'm starting a house call practice. I think you would be really good at this with me. Do it with me. And she was like, yeah. And that's why I love her, because I was like literally the whole conversation. I was like, I'm starting this. Do you want to do it with me? And she was like, yes. And I was like, okay.
That sounds
And that was
actually a
it.
lot like
So,
me,
yeah.
me and Kate. And we haven't
Yeah.
talked since. No, just
I
kidding.
love that. That's great. So it's a little different. Obviously, I've been doing it for years. She's brand new at everything, but I've always had like a very entrepreneurial spirit. I like being flexibility is important to me. So yeah, and I'll just go out there and work. So I still pick up relief shifts at different hospitals because it's not quite sustainable yet. So I'll work like all day, and then I'll do a house call at night, or I'll do it like in the morning before I go, or on the weekends. I do weekends, I do weekend nights.
Or she'll wake up at 5:30 in the morning so she can do Dr. Oz and then go to a shift.
I also do some media stuff on the side.
hustle is
Everything to
real.
grow. So,
Yeah.
That's amazing.
Yeah.
So it depends if you're not getting the brunt of my attitude. If you're not, you're not living with me, maybe when I'm tired and cranky.
How did the
And hungry.
media part come out? Come up.
Yeah, it's like a real crazy amalgamation of things. I think when I started the house call practice, I had like a month into it, I had a patient, Cat Stradamus, the largest cat in New York. I don't know if you guys have seen this. He went super viral. And so there were so many questions about his health as being a large cat. Like, why is he so big? What are you feeding him? Is he healthy?
How did that client come about?
That client came about, actually, we were quoted together in a New York Post article. So I was just, was it you?
One of my friends.
It was one of his friends.
No big. It's no big.
There was a New York Post. This is the longest
I
version of it.
used to work at the New York Post.
Oh, you
Did
did?
you really?
Comes full circle.
Yeah,
Wow.
yeah, it does. It's funny. So there was a New York Post writer who posted something on like a Facebook group looking for a veterinarian for a quote for an article about this cat. His friend recommended me.
And my
And
house
then-
call hairstylist.
I reached out and being right. And
Wait, do you really have a house call hairstylist?
Yeah, I mean it sounds
Christina, we love you.
super bougie when I say it that way, but
she's amazing.
basically,
Let's
yeah.
just do house call everything.
Yeah, for sure.
I mean, that's the way of New York City, right?
I'm
What
all
is
for it. I'm all
But
for
anyway,
it.
No, yeah. So we were in that article. I was quoted about him. So I reached out to him and I was like, we're in this, like, I love this. If you ever need a house call vet, I'm happy to come see you. And he was like, yes, actually, he's got like this thing on his face. Come today. And that was literally, so I was like, okay, I'll be there in 5 minutes. And then he just blew up. I mean, just took off. We did everything from like Harry Connick Jr. to
Wow.
Good Housekeeping, TMZ, Insight Edition, all the Facebook Lives. We
You
have
really
over-
had a fat cat
Yeah.
that put you on the map.
Yes. Yeah, Richie says it a little differently. But
yeah, I've been doing stand-up comedy for well over 10 years.
You didn't like that joke then? That got
No,
Oh, no,
she holds up one retarded cat. And Bravo Network might do a show about her. So happy for her. Just so happy. You did it, honey.
yeah.
All that hard work.
So yeah, and then I had a friend who was contacted by Dr. Oz about like pet food, and so she recommended me. It was all like at the same time, and then he was contacted by one of the largest agencies in Hollywood to represent him. Somehow he wound up pitching me, and they like loved it, and we've been pitching a show around the house call practice as well. So it's just like
Amazing.
a crazy bunch of. But also, I've reached out. I mean, part of it, I've just reached out to like all the influencers that I've worked with. I know we were talking about this before, Alex. Like, I'd just message them and be like, "Hey, do you want a house call? Because it's the best
I
thing
think-
ever." And
I think it makes you extra cool and extra
Thanks.
special because you have, I mean, as a dog business entrepreneur also in New York City,
yeah,
I think it's really exciting that you have this talent
thanks.
more than talent, as doctor. You have years of skill and training.
Yeah, and I feel the same way about you guys. I mean, really, when I first knew Kate, I was like, God, how do you have this whole like? To me, it's almost more impressive because like you have like an actual building. It seems so much more like adult in real life, where like you guys like have to manage a whole thing. And I'm like, I'm just going to do this. No, it was more complicated than that. But figuring it out, because like they don't teach us anything about business in vet school. I mean, I'm sure for the same thing for you. You know, we had to. Like, thank God Lauren just like knew a lawyer who knew something about startups, and it's like there's no handbook on this.
But
so
also,
it's really
I feel like with you, like, you know, when I watch you with patients and clients and stuff, like you have so much more personality than the typical vet that's just kind of getting you in and out. And it's just all about the medicine. Like, you know, I watch you and you have an actual connection with people, and people are like, oh my God, we love her. You know, like just because, like, even if it's that extra 10 minutes, it really goes a long way.
I think you're a great example of a business person who's using what they've got and what you've got and what you're good at. And I think it seems like you enjoy is talking to people in a very approachable way.
Yeah.
And I don't know. I think
that's
really cool.
Also, Pets and Punchlines has really gotten you out of your shell, I think, with like being more outgoing. That was part of the reason that we started it, was like, well, first of all, we just have, my friends are her worst clients, that it's like, you know, like, so I think when I left the house, I had 5 weed gummy bears, and when I can only find 2 of them. The dog is 6 pounds. What do I do? And I'm in the background like, eat the other 2. But she wants to like call poison control. But so, you know, so like there was always the thing was there that like we could comics wanted to get vet advice, but.
Well, it's genius.
But it definitely takes time, or took time, for you to not be super serious. I'm a doctor in a hospital, to be more yourself. It's like Dr. Lisa versus Dr. Lippman.
That's interesting. Well, it's interesting because it's like they have football players do ballet, or you know, or they have, you know, business people do
Toastmasters,
improv.
Like improv.
Oh,
you know, it's a similar kind of thing.
I will go out that window before I participate in comedy sports, just so you know. Guys, we're on the 19th floor. Or 18th.
So, Dr. Lisa, I would like to take this opportunity to find out a little bit about marijuana for pets. This is something I get asked a lot about these days because there's a lot of cannabis-based products out there.
So I'm going to preface this by saying it is very illegal for me to prescribe or recommend. It's not illegal for...
Is that in New York State? Or, I mean, I know
50
federally.
States. Federally. It is illegal. It is
for pets, it's illegal in every state.
So pets
even in states where it's legal.
So people can buy CBD oil or products for their pets, but veterinarians in all 50 states cannot recommend it. It is federally classified as a Schedule 1 drug, which means it has little to no or it has no medicinal value and has the high potential for abuse.
But in some states, people can prescribe. Right,
that's right.
Yeah,
it can be prescribed to people, but not to dogs.
Right,
in
that's
some
right.
States.
Yeah, and it's illegal for veterinarians in all 50 states to recommend or prescribe it.
It's amazingly ass backwards, if you ask me.
That being said, there is no regulated study right now. I think they're working on that. I think at the University of Colorado. Also, there is like federal congressional hearings to try to reschedule the drug. So there's a lot of things happening because
is that
anecdotally,
just for vets that they'd be rescheduling it?
No, it's the DEA on a federal level. Yeah. So and that's because anecdotally there are so many reports of it helping for things like seizures, anxiety, pain. And so I think that we definitely need a lot more research into looking into it. But the problem is with the things like the treats that have the CBD in it, we don't really know how much CBD is in there, and it still can be toxic for pets who will like get into the whole bag of a treat with. We don't really know how much THC is in there.
Is it that you don't know how much is in there or how much should be dosed for
I
the
mean-
dog
CBD
or
is
both?
completely non-psychoactive. That's the whole
There-
thing with CBD.
But there is a little bit of THC in it's not regulated. I mean, it's not regulated at all. So we actually just really don't know. And
Right, you'd have to have a super clean
who's doing the
source.
quality control on it? There is a known dose actually that is, I want to say it's like 0.5 to 2 mg per kg, according to the ASPCA poison control. So if you like call ASPCA poison control, and they can actually calculate like different dosages that pets get and what the toxic adverse effect.
Did you read that book, like Zoobiquity, I think it's called? Do you know the one I'm talking about?
It's
About the overlap of
the One Health. It's the One Health movement. I know Zoobiquity to be a conference, and the One Health movement being about
Can you explain?
veterinary.
So can you explain to listeners who don't know what the One
Listeners.
Health movement? I've never heard it called
Yeah.
that, but I think I understand what it is.
Yeah, and that's what the Zoobiquity conferences are based on. But basically, the coming together of all medical professionals, veterinary, human, to work together to solve our, everything from our food supply to zoonotic diseases, which zoonotic disease is a disease that's transmissible from animals to humans.
The jump.
That's right, the jump. So
Which is many.
So like when I was in vet school, we pioneered a course called the One Health course, which is basically we had like 13 different medical professionals. So everybody from like podiatry to nursing to doctors to veterinarians, dentists, all working to solve like one case. We would get a case and we'd all work together to solve it. So it was
That's super
really,
cool.
really cool. Yeah.
I think that's I think that's the coolest.
Yeah.
Yeah. You didn't finish your
I was going to give
poison
you my
control.
secret tip for poison control.
Secret tip time.
So if your dog is microchipped and registered with Home Again, which Home Again is like a $19.99, about a $20 service per
Right, and
year.
that's that little yellow house tag
Yeah,
that a lot
exactly.
of dogs have.
Yeah. Which your dog should be. Then, and you call ASPCA poison control, it's usually like a $60 or $70 charge to talk to a board certified
They
veterinary
get into
toxicologist.
chocolate or whatever
Right.
it is.
But if you have the microchip number and you're registered with Home Again, it's a free call. So it's very cool. I have called it myself several times. Right,
That's
Chloe?
good to know.
Yeah, it's great. I love it.
Going back to
Yeah.
Zoobiquity, because
Yeah.
I'm just obsessed with looking at
Yeah.
animals from the larger perspective. They talk about this case in this book. Maybe you know about this. I was trying to look it up because I forget which direction it goes in, but I think there was a problem where animals were getting heart-shaped. Do you know
You're
what I'm
talking about? Dr. Horowitz is the one who did the research. So she is a UCLA
Lippy is
cardiologist. Yeah, she actually
On it.
gave the commencement speech at my vet school. which
Oh,
is
wow.
So
Really?
cool.
So you know exactly what I'm talking about?
She's the one who's pioneered this movement, and that's because she's a UCLA-based human cardiologist, and they call her in regularly to the zoos in California to do work on like primates and things like that. And she was finding that animals were dying from essentially like cardiomyopathies, or basically when they would get so nervous and they would run themselves into what seemed like a heart attack. And she said, these animals are essentially dying of like broken hearts, but capture disease, she was also calling it. So when you go and capture an animal, they literally can die because they will like run their heart and their muscles, beyond what's capable for their body to sustain. And so, yeah, she really pioneered this movement for human doctor. But she's incredible. She does a TED Talk that's incredible.
What's the book again?
It's called, I believe it's called Zoobiquity.
Yeah, Zoobiquity is right, because she hosts the conference Zoobiquity, which
That
is the
sounds
One
like
Health
something I would
movement.
read. I might get on that.
And there's been a few things like that. Like,
But there, basically, what my takeaway from that book was there are a lot of problems that exist in one species,
Right.
that also exist in other species,
Yeah.
especially humans.
Yeah.
And in some cases, we know a lot about it in one species, but haven't,
Right.
other than humans, but haven't looked at it.
Yeah.
Vets have been in that area,
Yeah.
and vice versa, and that by sharing knowledge about how
Yeah, these
cancer
things
works in
exist.
all animals.
Yeah. Or like dogs don't really get heart attacks. They're kind of evolutionarily advanced in the fact that they don't get atherosclerosis like people do and don't actually have, they get different forms of heart disease, but they really don't die of heart attacks from atherosclerosis like humans do. So like what causes their arteries to be able to not produce that plaque buildup that humans get? So yeah, there's a lot of different things we can study in a lot of different species. I had one of my vet school professors was the one who actually discovered the link between West Nile virus in birds. She was a pathologist at the Bronx Zoo, and she was getting all these birds that were dying, and it was never diagnosed before, I think. And like, she was the one who made the link between birds and people, and having it be like, just so crazy contagion.
How many things do you have to eliminate before you come to that?
She just was a brilliant pathologist. I mean, and just like recognized it from studying, if we study, a lot of the books I used in veterinary medicine were in school, even were human, because it's just so.
What happened to West Nile anyway?
Where did you go to school?
I did a pre-med program at UPenn in Philly, and then I did vet school in California at Western University.
Aren't there two different kinds of vets? Like there's a DVM and also
there's a VM. Only if you go to UPenn for veterinary school, they have what's called a VMD instead of a DVM. It's just a veterinary medical doctor. It's the same thing. It's the same exact degree.
Penn.
It only is because he also went to Penn. It's only because their veterinary school started. Actually, this is interesting. Their veterinary school started out of their medical school. And also what's interesting is that it used to be like 100% men, and now it's over 80% women. But anyway, their veterinary school actually started out of their medical school, so they have veterinary medical doctor degrees, and every other school is doctor of veterinary medicine.
Did you want to be a vet when you were a kid?
Oh, boy, did she.
At what point did you realize that a portion of your job would be having to put animals down?
I guess I never that's a good question. I think I always just accepted it as part of, I never really thought twice about it, because to me, it's a gift we have to give, which is part of, why on house calls, it really is such a peaceful situation. And again, just really a gift that we have to give. It's something I really believe in strongly. So, I think I just try to think about it like that. I never really, to me, that's not the hardest part of the job. To me, again, that's me being able to help in the best way that I can. To me, the hardest part of the job is when I can't do my job, when finances are restricted or people look at animals as just property or abuse situations. Those are the hardest part. That's the hardest part of the job.
I've heard that from other vets too. And is that something you realized on the job, I'm guessing?
Also the debt.
The debt.
Yeah, I mean, the debt to income ratio is really, it's the worst. It's the worst of any medical professional by far. But
do you think that's part of the reason that we
have the highest suicide
rate? Yeah.
Yeah, definitely a big part of it. Yep. It's definitely a big part of it. And the fact that veterinary medicine is expensive, but if you look at...
People might not know that, by the way.
Yeah.
It's a profession that has some of the highest.
Yeah, 1,000%. It's very unfortunate. But the debt, the caseload, the amount litigious society dealing with people.
But I do think that it weighs on some vets, just the amount of death. I mean, because the life cycle is like 7 times faster for animals.
They say we see about 5 times more death than any human doctor. So
it's like, imagine if pediatrician. Wow. I think that's a thing that, like, if pediatricians delivered a baby or it's OBG, whatever, if they deliver a baby and then euthanize it, like, that has to have some effect on some people.
Sure, but I think also
oh, you mean if within the same lifespan of
because
I see what you're saying.
When a vet has a patient or client, they they see the full life cycle of it. But I think at least definitely does look at it the best way.
It's interesting.
Like, you're ending suffering. You're not killing something.
My husband studies like the ancient world, and we've talked a lot about how in other times people just lived with a lot more death than we have to live with. Like more children died.
Yeah.
People died from things that are easily curable now, and that in some way, I wonder if like the fact that we have pets is a luxury that if we were dealing with as much death of people as we are all the time, we might not have room in our hearts.
Well,
sure.
And there's the level of emotional connection that people have to animals now is like it's higher than it's ever been throughout our history. But like there's a study recently that that millennials have a more emotional bond to their dogs than to their siblings. Which is pretty wild.
Right. And that they're planning their entire lives around their pets, not buying homes in certain areas or staying in apartments because of the dog that they want to have.
I always think about those kinds of statistics or stories or just like that the way we talk about that or this moment of pet ownership with mixed feelings, because on the one hand, like I can see the point of view of like, oh, it's ridiculous. And like, like I said, I was a journalist for a long time. And so much of journalism is sort of looking at pets as kind of like less than us and as sort of accessories to be spoiled by young or foolish people, as opposed to treating them in the media as like equal parts of our life. That's never, in my experience as a journalist, been like a really normal way to cover pets. But I also think, so there's part of me that's still like, meh, whatever. So silly that these girls want to take their dogs to brunch or whatever. But then I also think it's awesome. You know what? Like if that's what you love.
Right.
And that's where you're putting your love and not rather than putting your love into, a new car, which isn't going to benefit particularly,
right.
Like if you're taking good care of that animal and like, that's all, and if it's keeping you from, if it's giving you connection and keeping you from feeling lonely. And like, I'm like, and if you become my client too, that's great.
Schoolfordogs.com.
Sometimes I'm like, can I leave him like an animal doctor? Like, they don't care.
And like,
the animals don't care.
But like on the zoobiquity level, like, I feel like you learn compassion and empathy and, you learn how to take care of something.
Which can only be a good thing for people in general. Yeah.
Yeah. So like, I think it makes sense that people feel that connection. There is never a building. There's no siblings buildings. No siblings over 60 pounds. Sorry.
How can you help your dog, your puppy, who you want to introduce to going to the vet? How can you make that a safe experience, a safe and happy experience?
That's funny when you say that. I mean, to my mind, I would say. I mean, I would tell people. I think this is all training, and I would kind of refer back to you too. But I would say like bringing them in, so carrying them, right? Never putting them down on the ground, just
in the
like
waiting room,
for sure. Never putting them down on the waiting.
Well, I think that's like
room.
A valuable piece of advice that many people wouldn't think of.
Yeah. So carrying them, not putting them down on the waiting room floor, because that is where a lot of the viruses live. They're very hardy, even despite what we do. So parvovirus and distemper virus, the two that we really want to protect dogs against, which is why they're transmitted mostly fecal oral, but poop is everywhere. I always tell people poop is everywhere. Like the tiny little particles, those viral particles are very hard to kill. They're very hardy in the environment, despite what we do. So that's why, if you put your dogs, if their paws are on the ground and then they lick their paws, they can potentially get infected. So if you bring them, carry them, don't put them down on a contaminated environment, wiping their paws down maybe when you're done with the appointment.
And what about bringing puppies outside of the home? Is there anything else that you think people should keep in mind to make sure that they're safe if they are getting their dogs out before they've had all their shots?
Yeah. So I'm sure you're well aware, the American Association of Veterinary Behaviorists actually states that after their second set of vaccines, that the benefit far outweighs the risk of them getting sick. So that's the time when they can go down on the ground. However, they should not go to places that dogs where we're unsure of their vaccination status frequent. So basically no dog parks, no pet stores, no place where you're really unsure. But if you do
junkyard dogs, can't hang out them.
Now, so I would avoid those high trafficked areas.
Isn't it possible for some dogs to be fully vaccinated even after their first round of shots? But we're just not sure if
so they're up to date. What happens with vaccines is any dog who's nursed from their mother gets maternal antibodies, and those antibodies can fight off our vaccines. It doesn't mean that they necessarily do, right? And if they're up to date on their vaccine protocol, then theoretically they should be protected.
The way I understand it is the reason their vaccines are given multiple times is because we don't know exactly when those antibodies wear off. But it's possible that the first round of shots has hit at the moment when the antibodies have already worn off. In which case, the first round might have worked. We just don't have an easy way of knowing.
1,000%. I mean, I think also
feel a tighter talk
we
cover.
Think. No, but we mostly think it's somewhere between 12 to 16 weeks, which is why we say they need to be vaccinated every 3 to 4 weeks until they're 16 weeks old, because then by that point we're sure that the maternal antibodies have worn off. But before that, sure, they could wear off. Or there's some puppies who really never nurse from their mothers, so they're bottle fed. Well, they're found as orphans.
Puppies?
Yeah,
Puppy lap.
Yeah. KBR, whatever.
Thank you so much, you guys, for taking the time to chat about this stuff. I found it really interesting.
Yeah, and we created a new business.
Yes.
I love it. You're coming with me. I didn't know if you know that, but
it's been a productive hour.
Yay!
All right.
Thanks for having us.
To have you also at School for the Dogs soon.
Yeah.
Maybe we need to have drinks with Dr. Lisa.
Yeah, drinks and increasing the human-animal bond, right? That's a huge thing. I would love to do that. I think he would have so much fun, like doing classes. He never did a class with her, so I think she would have so much fun. So
yes.
Just saying, let's increase our human-animal bond.
Most of our training is just me staring at her and telling her that Daddy don't play.
I'm sure Annie's going to tolerate that at the school.
Animal bond, because we're both animals.
That's interesting. Yeah. I like that.
And where can our listeners find you?
Oh, right.
Follow you?
Yes.
So our podcast is Pets and Punchlines. It's mostly comics with vets talking to comics with
Other
pets.
way around.
Comics with pets talking.
You get to be the only vet.
Yeah.
It's the world's only vet/comedy podcast. It's
Right.
Comics with Pets talking to vets.
That's right.
That's what
it's
you're trying to
usually
say
me,
there.
but I have had other vets
also
on.
an interesting podcast if it was just a comic talking to if you talk to a different vet every time.
Yeah.
Or you could just talk to a different girlfriend every time.
Yeah.
You could try one out for the day.
She's pretty well anchored on this podcast.
Not actually suggesting
That's
that.
funny.
Just giving you
now I'm just thinking how
other
can we do
ideas.
that?
Yeah, neither one of us are going to shake each other on this podcast. It's way better than being
We do break
married.
up every podcast.
It's like the Beatles.
Typically,
It only functions when it's...
Yeah. Otherwise, it's wings. Ugh. But it's way better than being married. We've got a podcast together.
At vet_in_the_city_ at Dr. Lisa Lippman on Instagram and everything else.
At Richie Redding.
All right.
Yeah.
Yeah. Thanks so much.
Thank you so much.
So fun.
Thanks, guys.
So informative.
Thank you both.
Okay.
Yeah. Right on.
Next time. Bye.
For our fun dog fact of the day, I thought I would share with all of you that the very first veterinarian in recorded history lived in Mesopotamia around 5,000 years ago. His name was Galadina, and we actually have an image of him, which I will put in the show notes at School for the Dogs.
If we could talk to the animals, just imagine it, chatting to a chimpanzee.
But I believe he mostly worked with non-human animals. Our woof shout out of the week goes to Reggie. Reggie is a wonderful Boston Terrier who I first met when he was a tiny puppy 4 years ago. And since then, he's been coming to School for the Dogs 3 or 4 days a week, possibly more, with his owner, Mona, who is one of our favorite human clients. Reggie is a Boston Terrier. He has done a lot of great things in our day school, including learning how to stand up on his front legs. We've taught him to do a handstand, which is pretty adorable, or I guess you'd call it a paw stand. Anyway, sadly, Reggie is moving away from School for the Dogs to the Upper West Side, and we are going to miss him so much down in the East Village that it's possible we might just have to move up.
Thank you so much for listening.
We'll be back next week with another show. If you liked this episode, please remember to subscribe, rate, and give us a 5-star review on iTunes. And of course, tell your friends. If you have suggestions for future topics or questions about training, please make sure to join our Facebook group, facebook.com/groups/school for the dogs. See you next week.